Hello, everybody. My name is Ogechukwuka Okonji, and I'm a student of Western Sydney University. This is a photo of my student ID card.
And today I'll be discussing on a case study on prostate cancer in a 69-year-old man named Nicholas. He was diagnosed after having a high PSA level of 7.5 along with an abnormal examination and a biopsy showing a Gleason score of 7. He since had surgery and he now has a catheter placed because of the surgery. Now we're going on to the pathophysiological aspect of this case study, or should I say of this prostate cancer? Yes. So what is prostate cancer? Prostate cancer develops when abnormal cells in the prostate start to grow uncontrollably. According to Nahas et al. In 2024, this happens because of changes in how the cell grows and functions. These cancer cells are also affected by male hormones like testosterone, which helps the tumor grow. As the cancer develops, it forms lupus in prostate, and in more advanced cases, it can spread outside the prostate into nearby areas. In Nicholas' case, the cancer is locally advanced, meaning it has spread beyond the prostate, but not to other parts of his body. This was confirmed through the imaging as outlined by Cancer Council in New South Wales 2024. His Gleason score of 7 shows that the cancer is moderately aggressive, meaning it could worsen if not treated properly. As discussed by Yin et al. In 2022, it can also spread through the blood and lymph system, which is why the lymph nodes were removed during his surgery. There are also various risk factors when it comes to cancer. Now, age is one of the biggest factors. Nicholas is at a higher risk because he is 69, which is one of the risk factors. And he also has a strong family history, which is suggested by Nuka et al. In 2021. Even though he is physically active, healthy people also have a risk of having prostate cancer. Early detection through PSA screening played an important role in identifying in his condition, as noted by Amano and Suzuki in 2022. Now we are going to move on to the pain management. Pain management is a top priority following a prostatectomy because uncontrolled pain can delay recovery and lead to complications such as reduced mobility and respiratory issues, as identified by Mukal et al. In 2022. Now, in Nicholas' case, his pain is related to an abnormal incision, tissue trauma, and the presence of urinary catheter. Now, when we move into the pharmacological interventions in the use of opioid analgesic, such as morphine or oxytocin, this works by acting as a central nervous system to reduce pain perception, making them effective for post-operative pain, as explained by Nahas et al. In 2024. Nurses play an important role by regularly assessing pain and monitoring for side effects such as sedation, nausea, or constipation in older adults. Now we move on to the non-pharmacological strategies. Now, non-pharmacological strategies are also important as they help in a lot of ways. Now, early mobilization helps improve circulation and reduce complications such as blood clots, as suggested by Mongovan et al. In 2021. Another non-pharmacological strategy is positioning. Positioning is a useful strategy. Keeping the patient in a semi-fowler position reduces pain in the incision. And we also have supporting the wounds during movements. Supporting the wounds during movements can help reduce discomfort. Combining the pharmacological and non-pharmacological approaches provide better pain control, as highlighted by Amano and Suzuki in 2022. Now, wound care. We're moving on to wound care. Wound care is a very important aspect when it comes to operation. Okay, wound care is very important. Now, one key nursing intervention in wound care, in aseptic wound care, involves assessing the wound for signs of infection, such as redness, swelling, discharge, or increased pain. And this is suggested by Yin et al. In 2022. In Nicola's case, the catheter also provides a pathway for bacteria. So maintaining aseptic technique during dressing changes is essential. This has shown to reduce infection rates as noted by Moka et al. Another priority for catheter care for nurses is for them to ensure that the drainage system remains closed. Urine flows freely and the bag is positioned correctly. We also have to monitor the urine output. We monitor the urine output and also monitor for signs of infection, such as cloudy urine or fever. The catheter is usually kept in one place for 2 weeks to allow proper healing. And this is as outlined by Cancer Council New South Wales in 2024. Okay, now we're moving on to the discharge and multidisciplinary care. That's the final aspect. Now, discharge education and multidisciplinary care are essential paths to recovery and prevent complications, as highlighted in Cancer New South Wales in 2024. A major focus in catheter care at home is understanding hygiene and recognizing signs of infection. Urinary incontinence is common after surgery, and pelvic floor exercises can improve outcomes. Finally, a multidisciplinary team supports recovery. The urologist supports PSA level according to the Cancer Institute New South Wales in 2024, while physiotherapists and incontinence nurses support rehabilitation, as discussed by Yin et al. In 2024. Together, this team approach improves recovery, reduces complications, and supports long-term outcomes. Thank you so much for watching. I also have my reference list here, just in case you want to take a look at it. Thank you so much. I hope you enjoyed watching.